The world around us is filled with wonders. We can see nature's beauty. We can smell the rain. We can hear the chirping birds. We can feel the sun on our face. Yes, we can sense the wonders around this world with ease. Besides, we can understand human feelings, conversations, facial expressions, behaviors, and much more. But have you ever imagined what the world would look like for autistic children? Autistic children are those kids that have a developmental disorder called autism spectrum disorder affecting their communication and behavior. These children may be as young as 2 to 3 years old up to 18-year-old teenagers. They are unique in their ways. Do you know how? Some may not recognize others' feelings. They may not listen to things around them. They may have restricted interest, and they may not share the enjoyment of activities around them. Sometimes we categorize them as abnormal kids, restrict our kids to mingle with them, or don't allow our kids to talk to them. But is that the right way to treat them? Absolutely not. They are all ordinary human beings just like us. As parents of these children, it's our responsibility to support our children and be empathetic to the way we see the world. Hello, and welcome to my channel, Parenting Autism Today. In this video, we will walk you through the autism spectrum disorder and the essential information on how autism is diagnosed, supported, and much more. Don't forget to hit the like button and tell us what you think in the comment section below. Subscribe and enable notifications for more detailed videos about parenting autistic children in today's day and age. Have you ever heard that there are different types of autism? Do you know what the story behind various editions of mental disorders like autism is? Here it is. Yes, the American Psychiatric Association published the Diagnostic and Statistical Manual of Mental Disorders in 1952 to assist the clinicians in diagnosing their patients with mental disorders, to put forward a complete treatment plan that is apt for each individual. The fifth and the latest edition of the DSM, released in 2013, replaced the previous subgroups of autistic disorder, Asperger's syndrome, pervasive development, and disorder not otherwise specified in childhood disintegrative disorder with a single term, autism spectrum disorder. It is with DSM-V that you can be well aware of the signs and symptoms of ASD. According to DSM-V, autism spectrum disorder is diagnosed based on two factors: social communication and restricted, repetitive behavior or interest. This raises the next question: how to conclude that an individual is affected by autism spectrum disorder? One fine morning, if your toddler behaves unusually, you would be totally perplexed and tensed. Several queries would be raised in your mind within a moment. But is it the autism spectrum disorder or any other problem? Think twice. In layman's terms, autism spectrum disorder is a complex developmental disorder with symptoms including persistent deficiencies in social communication and social interaction at various circumstances and constrained, repetitive patterns of behavior, interest, or activities. Suppose you notice the issues with sharing personal interests and emotions, the facial expressions when interacting with peers, repetitive movements or speech patterns, and adherence to certain routines in your young children. In that case, you can need to seek professional help to confirm if your kid is affected by the autism spectrum disorder or not. Do you know who the first person to be diagnosed with autism was? It was in year 1933. Donald Gray Triplett was born in America. At an early age of 2 years, his parents found Donald to be a profoundly introverted child who did not understand his parents' language and was not interested in playing with other kids. But every child is special and unique, right? Donald created his world of number patterns, musical notes, and the English language. At the age of 5, Donald was diagnosed with a kind of syndrome not formally listed in the medical journals by Austrian child psychiatrist Leo Kanner. Later, in 1943, he found another bunch of young children with a similar disorder and called it infantile autism, which was later summarized as just autism. I know the above described case paves the way to the next question in your mind. Who is diagnosed with autism? Are there any special causes for autism? How is autism diagnosed? Some various signs and symptoms make you decide that your children are affected by autism spectrum disorder. Let's have a detailed look into those. The young children or young adults with ASD might not point at objects to show their curiosity, not look at items when other people point at them, avoid eye contact when mingling with peers, no response when someone's calling their name, have trouble understanding other people's feelings, or have difficulty in expressing their feelings and needs. Prefer not to be held, hugged, or cuddled. Keep avoiding when others talk to them. Keep making unusual and repeated sounds. Not knowing how to speak or play. Repeat or echo the words or phrases said to them. Repeat specific actions again and again. Getting upset if there are slight changes in routine. Have unusual reactions to the way things smell, taste, look, feel, or sound. Being more or less sensitive. Always wants to be alone. Have sleep issues. As you can see with this extensive list, the autism spectrum is a very wide spectrum of signs and symptoms. We will cover many of these topics on this channel and the impact to parents of these children to better serve and prepare us for the needs of each child. Don't ever think that parenting an autistic child is a misfortune in your life. Do you know why? Even though children with ASD experience many challenges and have special needs, they can also have many skills and abilities. What are they? Able to learn things in detail, memorize certain information for long periods, being healthy visual and auditory learners, excelling in math, science, music, or art, and more. So, parenting these special kids is a boon in one way or another way. I'm not saying that all kids would be like Dr. Sean Murphy in Good Doctor series, but these young children are definitely a blessing for their parents. When can these symptoms appear in a child? When do the parents need to consider them? In simple terms, the ASD symptoms usually appear in the first 2 years of life, and it occurs in all ethnic, racial, and commercial groups. Moreover, ASD is 4 times more common among boys than among girls. In 2020, it was reported that about 1 in 54 children had been identified with an autism spectrum disorder. Most of the ASD cases are diagnosed in young children of 4 years. Doctors diagnose ASD by analyzing a child's behavior and development. Signs of ASD can begin in early childhood at about 2 to 3 years and teenagers of about 15 to 18 years. Do you know that the exact cause of ASD is still unknown to the world? Pitiable, right? With so much advancement in technology, the researchers have not still concluded the exact cause of ASD, even though there are certain risk factors for autism, like having a direct family member with autism, genetic mutations, being born to aged parents, reduced birth weight, imbalanced metabolism, vulnerability to toxins and chemicals, a history of viral infections. Are there any unique ways or tests to diagnose ASD? Do you know that diagnosing ASD can be challenging as there's no medical tests, like blood tests, to diagnose these disorders? Still, there are different screenings, genetic tests, and evaluations to interpret the same. The diagnosis in young children is a 2-stage process. First is the general developmental screening that includes well-child checkups with a pediatrician or an early childhood health care provider. This screening is at the age of 18 to 24 months and is combined with the knowledge and experience of parents about the child's behavior. The young children who show developmental problems during this screening process are referred for the second assessment stage. This second evaluation includes a slew of tests like visual and audio tests, behavioral evaluation, language ability tests, DNA tests, and developmental questionnaires. The best thing is that this evaluation is conducted with a team of doctors and other health professionals who are experienced in detecting ASD. Is it a similar process that we follow in diagnosing ASD in adolescents and young adults? In such children, ASD is often first recognized by parents and teachers and then evaluated by the school's special educational team. Then, they recommend these children to visit doctors who specialize in ASD for additional testing. Thus, all the screenings and tests pave the way to further stages of treatment in ASD. Are there any unique treatments to cure autism? Surprisingly, no. Instead, various therapies like behavioral therapy, play therapy, occupational therapy, speech therapy, chelation therapy, and physical therapy, etc. can suppress this disorder. Besides, some people can respond well to massages, meditation techniques, special food diets as a part of the ASD treatment. Many research studies supported by the National Institute of Health and the National Institute of Mental Health focus on understanding ASD and indicating the best diagnosis and treatment options for this disorder. As per UNICEF, early detection and treatment is key to preventing episodes of mental distress reaching a crisis point and precious young lives being damaged and lost. Yes, there is no doubt that early detection helps in better treatment, whatever the disease or disorders are. Similarly, the most effective therapies in autism spectrum disorder involve early and thorough behavioral interventions. The earlier a child is part of these programs, the better their outcome will be. As per Stuart Duncan, the famous American musician, autism is not a disability. It is a different ability. So treat these unique children as one among us and let them enjoy the world along with us. Have you got a general idea about the autism spectrum disorder, its causes, symptoms, and treatment? I hope yes. You can dive into more details and have an insight about the autism spectrum disorder on the links below. www.healthline.com/health/autism #causes. www.helpguide.org/articles/autism-learning-disabilities/autism spectrum disorders.html. www.cdc.gov/ncbdd/autism/facts.html. www.nih.health/topics/health/autism-spectrum-disorders-asd/index.html. If you like our video, don't forget to subscribe to our channel and click the bell. More videos are on the way. Be sure to like the video and feel free to add any suggestions you would like to see in the comments section.